Okay, go ahead.
All right.
Do you have a pocket that you can stick this in?
No, but I'll try to balance it right here, I think. Okay. All right, everyone has? Yeah, we're good? Okay, so the first very common question that people will ask is, do I need extra calories while I'm breastfeeding? You know, people always think I can eat whatever I want when I'm pregnant, I can eat whatever I want when I'm breastfeeding. It's really not necessarily the best idea. Generally, we tell people when they're breastfeeding, you need about 500 extra calories per day. Now that's general, that's what we tell people. So an example, I did write one example of what 500 calories is, you know, a whole wheat piece of bread with a tablespoon of peanut butter, plus a piece of fruit with some yogurt. There's 500 calories right there. Nice and easy. A slice of pizza usually falls in that category, around 500. 5 cookies is about 500 calories. Not that I'm recommending that people gorge on cookies, but just to give you an example of what 500 calories looks like. But there is some room for individuality in there too. That you don't, first of all, nobody wants to count calories. We don't recommend anyone sit down and count calories. It's a little obsessive, it takes up a lot of time, it's not worth it. But just know that in general, you do have to eat more. Somebody who has more body fat probably doesn't need 500 calories a day. If a woman is losing weight too fast, they may need to bump it up. So that's a general recommendation, 500 extra calories. What food should I eat while I'm breastfeeding? Basically, it doesn't really differ that much from general nutrition. For a regular adult, for a postpartum formula feeding mom, it pretty much all falls in the same category. You want your fish, you want your lean meats, you want your good protein sources, you want whole grains, good carbohydrates, a lot of fruits and vegetables. So you guys have seen My Plate, the US government My Plate, right, with half the plate vegetables. That's what we recommend for everybody. So general nutrition, general healthy eating, good for breastfeeding moms too, for sure. The one thing I did note in here, which I thought was really interesting, was it's good to get a variety of foods. Does anyone have a picky eater, child who's a picky eater? Yeah, me too. So, you know, one of the ways to possibly avoid that, again, there's no guarantee, but one of the ways is to really eat a good varied diet while you're breastfeeding. Because the baby will get the flavor. You eat curry, the baby is going to taste the curry. You eat hummus, they're tasting hummus. Whatever the nationality, whatever you want to use, spices, etc., it's going to help them accept foods later on. So it's definitely a good idea to get a good flavor variety in there.
Is that really documented?
Is it documented? Yes.
Wow.
Yeah.
Is there any allergy information on that also?
Yes, we will definitely get into that. Yeah, for sure. Are supplements important? Most doctors will tell you to keep taking a prenatal vitamin while you're breastfeeding. I think that's good general advice because it covers your bases, for sure. If you don't want to take a prenatal vitamin, I know some people have GI issues with it because of the high iron content. Some people get constipated, get nauseous, vomiting, etc. If it's impossible for you to tolerate that, then the one thing I would definitely recommend is the DHA EPA. You guys have heard of omega-3 from fish? Most people have. What that basically is that it is a very important factor in the neural development of a baby. 60% of our brain is made up of that. 60% of the human brain is made up of specifically DHA and EPA, which is the type of omega-3 that comes from fish. Most prenatals have it, so if people are taking their prenatal, you're pretty, guaranteed to be good on that end. If you're not, I definitely recommend, and I didn't put the amount, but it's about 500 milligrams a day of a DHA, EPA, omega-3 formula for somebody who's not taking a prenatal, okay? The only other supplement I usually recommend for the mom is iron, not at the beginning. At the beginning, the mom really doesn't need an iron supplement, but about 6 months in, what tends to happen is the woman starts getting her period again, right? She starts having it again, and then your iron stores start to diminish. So if you think about the mom's iron stores are diminishing after 6 months, that's when it's time to start supplementing to make sure that the content stays the same in the milk. And we want moms to breastfeed for at least a year. The American Academy of Pediatrics agrees with that too. At least, it's good to breastfeed at least a year. And so post 6 months, good to take that iron supplement. The amount, again, I didn't put it, I apologize, but it's about 10 milligrams. or any iron supplement that says 100% of the daily value. Yeah.
Do they need iron in addition to the prenatal?
No. If you can tolerate the prenatal, that's good enough. This is more if you can't tolerate it, what the important nutrients are. Yeah. I did put in a little information about the baby in there too, although we'll sort of get to that separately later. The question very often arises, do I supplement my newborn? They used to recommend Trivisol all the time, right? That was a big one for a while. Yeah, A and C, okay, you're probably getting that in the breast milk. It's vitamins A, C, and D are in there. D is the one that's crucial. So we definitely still recommend 400, it's called IUs, International Units of vitamin D for the baby, starting from birth. If they happen to be in a hot climate and if they're exposed to sunlight very frequently without sunscreen, they may not need it. I think it's a good backup to have. Vitamin D is coming out more and more in research as just being so crucial for, avoiding illnesses and immune function and all these things. So it's a good idea. Vitamin D for the baby, for sure. Okay, any questions? Any good? We're good? Okay, so how much fluid do I need when I'm breastfeeding? Anybody who's breastfed knows you get thirsty, right? You do. It's just natural. Middle of the night, you're dying for a glass of water. You get thirsty. So a lot of times your body is telling you what you need, but if people are concerned and they need a guideline, we usually say about 13 to 16 cups of water just to keep up with the milk. Now, normally we say 8 glasses of water a day, right? For a normal, healthy adult, 8 glasses. We say 13 to 16 for somebody who is breastfeeding, especially at the beginning before the baby is starting solids and the milk supply tends to dwindle a little bit. It's a good idea to get that much. Fluid comes from food too, so if people do feel that they want to sit and count their fluids, I usually remind them that anything like ice cream, Jell-O, anything that melts down to a fluid, pudding, soup, anything like that, that counts. Absolutely counts in your fluid intake for the day, so people don't have to panic. It's not a bad idea for them just to drink a glass of water while they're nursing. Why not, right? It helps, and it'll avoid dehydration too. Obviously, juice, sugary drinks, that's basic nutrition, again, that we want to avoid those. We want to avoid excess calories and excess weight gain, both in the baby and in the mother. Okay. Again, I threw a little bit of information about the newborn in there too, because people always say, oh, should I give my baby extra water? Should I give them a bottle of water? No. If they're nursing, if they're formula feeding, and they're getting enough and they're gaining weight, there's no reason to supplement water. None at all. They'll get enough. Okay? Next page. Any questions?
In a very hot climate, even when it's like, I lived in Arizona, so like even when it's 100 degrees outside, there's no need to continue.
In general, you want to watch a baby for sure. A baby is more sensitive, especially a newborn, is more sensitive to the heat. And, certain things are not functioning as well yet in terms of their ability to control their own temperatures, their internal temperatures. It's not a bad idea to keep them in a cooler area if possible. But no, I don't think there's any need to supplement water as long as they are continuously breastfeeding. It's probably a better idea just to bump up the milk. That's it. Okay. Vegetarian diet I throw in there because some of the crucial nutrients for breastfeeding are found in meat. So iron is one of them, protein is another, calcium is found in dairy for any vegans out there. So there's nothing wrong with it at all. Nothing wrong with the vegetarian diet, nothing wrong with the vegan diet. We just have to make sure we're getting enough of those nutrients that are very, very important. Lentils, whole grain, wheat, whole grain, anything that's a grain, peas, dark leafy vegetables. We'll get into iron a little more later. For protein, if you can do eggs and dairy, do eggs and dairy. If they don't, they definitely want to do soy, meat substitutes, a lot of beans, a lot of nuts is a really good way to go. Okay, the one supplement that we do recommend with a vegetarian diet is B12, because that's the one nutrient you really can't get anywhere else. B12 is a good supplement. You can always just tell your doctor to add more B12 to your diet. If you're taking the prenatal, probably don't need it. The supplement's in there. Okay? Foods and drinks to avoid or limit while breastfeeding. Alcohol. Really, it's best to avoid it completely. And in general, it says that it takes about 2 hours to get out of the system. So if you do have an alcoholic drink, most women I find aren't drinking on a regular basis. Not at this stage in life, not when they have a newborn. So it's not usually that much of a concern. But if they are, it's a good idea to, nurse the baby before you have that drink. Once you have that drink, wait 2 to 3 hours before you feed again. Yeah.
I'm actually seeing other research from the birth center that talks about very, very minimal alcohol coming through, like so much so.
Yeah.
It's like barely anything at all.
Yeah, I mean, if you think...
Even if you drink a big beer, it's actually a good
Yeah.
production. It helps produce more milk.
The beer can produce more. Yeah, it's still not a good idea for them to get that alcohol, though.
No, I mean, like, I don't want to get drunk and try to take care of the baby.
Right, exactly.
The guideline was though is that if you're able to if you would drive your car safely, like it's okay. Like that's what I've always been told.
I thought you were supposed to pump and dump.
So that's another thing that people say is pump and dump. I usually recommend against it, truthfully. You can, but it would have to be after that 2 to 3 hour mark. Now, if you think about a newborn, they're going to want to eat, they're going to want to eat every 2 to 3 hours. So if you pump and dump an hour into that, you have your drink, you wait an hour, you pump and dump. Your body, it's still in your body. It's still coming through in the milk, so it's not going to make a difference. If you pump and dump at 2 or 3 hours, that's beneficial, for sure, because now you've gotten rid of any potential alcohol that ended up in that milk, but your baby's probably starving at that point. You know what I mean? So not a bad idea for if the baby is older and you can give it some baby food or something else along the line, but at the beginning, I really wouldn't.
Or if it's supplement formula.
Right, exactly. Yeah.
I'm absolutely not advocating for drinking during.
Yeah.
But they actually make these strips that you can test your breast milk with.
Really?
Yes.
Yeah, those are actually I think the research was proven that those were faulty. Like they were
It's very
taken out of
possible.
the market for most
Really?
places. Yeah.
Okay, so when I had my baby 2 years ago, I was told about them.
Mm-hmm.
By a friend who happened to have used them, and I thought it was like the craziest thing I'd ever heard. But
Yeah, there was a big outrage about them because
Yeah.
it was just another thing being
So-
marketed to breastfeeding moms that was unnecessary. Which there's a lot of that stuff out
There
there.
is. It's very true.
Sorry, that's like the
What is the risk of the alcohol on the baby,
Neurological development?
even at post birth?
Yeah. I mean, babies are pretty much developing at a similar rate to when they're in uterus.
But it's not so.
Initially.
Are we looking at fetal alcohol syndrome post delivery, or not that severe?
No. I mean, more likely the baby would sleep and get tired. Most likely it probably wouldn't really hurt the baby, but you wouldn't want it to be frequent. It's very similar. Okay, good. Let's see. What do we have next? Okay, caffeine. All right. Now, here's the thing with caffeine. There's a lot of research out there and there's a lot of studies out there. American Academy of Pediatrics is saying you can have 300 milligrams of caffeine while you're nursing and it's not likely to affect the baby. Personally, I think it's very individual. Everybody's metabolism is different, and when we give these general guidelines, sometimes we have to think about the fact that, but maybe it does affect my baby. It's like somebody who takes a medication with, very little risk factor, but then they experience one of the side effects that's very low risk, that's not supposed to happen or happens very infrequently. It can affect the baby. It can overstimulate them. It can keep them up. Probably it won't. 300 milligrams, which, is pretty much equivalent to I'd say no more than 2 cups of coffee. This one says 2 to 3. I usually say no more than 2 in a day. That's the general recommendation across the board for everybody, for healthy adults, to have no more than 2 cups of coffee a day or somewhere in the 300 range of caffeine from any source. Yeah.
sorry, you said you put in parentheses 16 to 24 ounces. That would be.
That's
one
2 to
cup,
3
16 to
cups.
24, okay.
16 ounces is 2 cups, 24 is 3. Yeah. Yeah. So, again, it's one of those things, tell mothers, if your baby's irritable, maybe cut the caffeine. It's chances are it's going to be fine, but it's something to keep in mind that it is going to affect some babies, and if your baby's one of them, you might as well take it out, if possible. Kind of make sense? Yeah? Okay. Fish, I guess everyone's heard about the fish with the mercury, right? So it's this hard balance because you really, really need that DHA, EPA that we talked about, the omega-3, but fish can be high in mercury, again, leading to neurological development issues, things of that nature, in high doses. I did find a really good list. This was actually a list for pregnant women, pretty much goes for breastfeeding too. Foods that are high in omega-3 and lower risk for the contaminants, such as mercury. So herring's in there, if anybody likes that. Salmon is in there. Salmon is always a good bet. Tuna, canned, not so bad. Trout is a good one because it's actually fairly reasonably priced. It's also high in there, so obviously not mussels in this crowd, but there are some options for pregnant women to eat fish and nursing women to eat fish twice a week. Yes?
As far as the DHA, does it matter if it's farm raised or wild caught?
It is more, it's going to be higher if it's wild caught. What it is the fish are actually obtaining it from seaweed. Somebody who eats seaweed. Does anybody eat sushi wrappers, seaweed snacks? I do. I think they're good. But anyway, that's where they're getting it from. So fish who are being farm raised and maybe are not being fed the same diet, it's going to be lower. It's still there, but it's going to be lower.
Yeah, is it like worth eating farm raised?
I think it still is. But in terms of nursing mothers and pregnant women who really, really need that DHA, and children, by the way, who really need that DHA, it's better to go wild caught or supplement. Yeah.
I've heard that there's a difference between the albacore white tuna and then the light tuna, but
Yeah.
it seems then you're also then getting less
You're,
DHA.
yes. Yeah, you're getting less. I recommend the canned.
Well, I mean, I'm talking about canned. There's canned.
The
white,
canned
there's
chunk.
Canned chunk light.
The chunk light, I
Not
recommend
chunk
that.
White,
Right.
chunk light.
You're getting less DHA, but it's a little safer.
That's safer.
Yeah.
Because of the mercury. There's less mercury.
I mean, albacore is still on the list. It's not terrible, but it is a little higher in the mercury.
Also, doesn't flaxseed oil have?
So fats are complicated. Yeah, I'll talk a little bit about flax. That comes up a little bit in the presentation too, which we'll get there. But fats are very complex. And I will talk about this also, that you really need a good variety of fats. Things like walnut oil, flaxseed oil, canola oil, olive oil, these are all good sources of ALA, which is another type of omega-3. So there's ALA, and there's EPA, and there's DHA. ALA you're going to get from your plant sources, walnuts, flaxseed, etc. The DHA and the EPA only come from fish. Now the body converts ALA to EPA and DHA. But I mean, it can convert at a different rate in different people. If somebody has GI issues, if somebody has certain things going on, if somebody is taking antibiotics and getting rid of the bacteria that convert it, it's not going to work. So it's better to supplement straight out. Yeah.
I just wonder if mothers who are taking the prenatal vitamin that have the DHA in it should have any concern also to be eating fish along with that, or it's not.
You mean in terms of going over?
Right, exactly. Is it not enough that it?
You really can't. Yeah, you really can't. They say in very high doses it can cause some blood thinning, blood clotting issues, but I really don't think it's that big of a deal. The body, thank God, has tendencies to really, if you're getting too much of something, you'll just pee it out, truthfully. Not 100%. We'll talk about vitamin toxicities. They do exist. But for the most part, your body will say, we don't really need this, and it won't absorb it. Yeah.
Just to clarify, these milligrams for the fish, this is saying the levels of DHA and EPA for each item?
Yeah.
What is this, yeah?
Yes. Okay. Okay, so somebody mentioned earlier allergic reactions. We'll talk about this. Yes. What you eat goes into the breast milk directly. Absolutely can cause allergic reactions in a baby. Did anybody ever experience this before? With a child? Yeah, I have too. So what happens is usually some of the following symptoms that I wrote. Fussy is one of them. Fussy could just be GI pain, ultimately. Reflux, rash, any kind of eczema on their body, diarrhea, ear infections, congestion, sometimes asthma and wheezing are in there in terms of signs of some sort of allergic reaction. Now, I do want to clarify that there is a difference between a food allergy and a food sensitivity. A food allergy is what you need an EpiPen for, right? And if your child is really experiencing some sort of major rash kind of thing, it could be an allergy for them. More likely, it's a food sensitivity, which isn't as scary and it isn't as dangerous. So just to keep in mind, if it's no matter what, go see a doctor. Ultimately, is good advice for the mom. If your baby has a rash that's not clearing up, if your baby's getting very frequent ear infections, check it out. Look into allergies. But ultimately, at the end of the day, a lot of times it's a food sensitivity. Still good to stay away from it though. There's a couple different things you can do about a food sensitivity. One is, and I wrote this down, eliminate a food one by one. However, if there's a parent dealing with, and for those of you who have experienced, maybe you have had the same experience I did, which is that, if your baby's fussy because of a food or because they're itchy or because something's going on, they're miserable. And a mother doesn't want to take the time to eliminate one food at a time. We're not going to say, yeah, I'll take 2 weeks to avoid wheat and see if that makes a difference, and then I'll take 2 weeks to avoid milk and see if that makes a difference. Truthfully, I think it's easier for the mother in dealing with a newborn to eliminate them all. All these potential allergens: milk, nuts, soy, wheat, eggs, and corn. It can be done. It's hard. It's definitely hard. You definitely need a trip to Whole Foods for sure. But it definitely can be done, and then everything clears up. And then you can add the foods in one at a time and figure out which one was bothering the baby. Yeah?
If your baby has one of these reactions, the sensitivity, and you eliminate all these things, then eventually, is that child going to have allergies when they get older?
No, allergies can really develop at any point during childhood from what I've seen at my pediatric practice. But if they're having a major reaction, there's a fair chance that they're allergic to something. But a food sensitivity can carry through, absolutely. There's a lot of kids getting tubes out there. There's a lot of kids getting speech therapy out there. And what it is they have issues related to dairy. So a food sensitivity is still significant.
And that is not necessarily the case that a child will
That it will carry through? No, sometimes they go away.
None of my kids have food allergies.
Yeah.
And I had 2 kids with sensitivities.
Yeah, and like I said, I think even when your child's older, when a child's 3 or 4 or 5, it's easier to take the foods away that are bothering them and then re-add them one at a time to see if they tolerate them, because they may. Yeah, definitely. Any other questions on that? Yeah.
In my experience, these foods, this complete list
Mm-hmm.
is very hard to cut out.
It is.
And that it's not usually what causes food sensitivity in babies.
What do you find that it usually is?
I have a huge list that I got from passed down through baby nurses given to me years ago. And these things are not on it, and they call it the anti-colic diet.
Like cauliflower and broccoli kind of cabbage.
Yes, but the list goes
It goes on. It's on. These are what we call the most common.
That list is much better to do, even though it's longer. It's much easier to cut
It's
out.
easier, yeah.
And that's where the food sensitivities, in my experience, these are the allergens. There's a true allergy. These are the big foods.
Yeah, I definitely hear you. There's definitely other things in there that can absolutely be eliminated, that are probably easier, that may cause it. I've definitely seen issues with wheat, soy, and dairy, especially 100% seen issues with those in babies and in pediatrics in general. But yeah, for sure. I mean, anything that works that you want to eliminate, if it's easier to start with that, absolutely. There's no reason why not. The whole goal is to ultimately figure out what's bothering your baby. And if a mother wants to do it quickly, great. And if a mother wants to do it on a slower basis and try something like that first, absolutely. Yeah.
Oh, the anti-colic diet? I think
Get everybody a list, and I'll bring it down.
Ultimately, we think colic is probably caused by, one of those things on that list. This problem is determining which one it is in each individual.
No, 'cause I remember I had experience directly with broccoli. It was so obvious. As soon as I had broccoli, which I love, after I fed the baby,
Right.
cry all night.
It's very, very individual. Another option is to do something like that. Do a food journal. That it ultimately takes 2 hours for something to get into the milk. So when you're eating and then you notice your baby's miserable, definitely write down what you ate and try to find a trend, for sure. Any other questions? Allergies?
I mean, for my kids, I guess the symptoms got worse than this. Like my kids were failure to thrive because of food sensitivities.
Yep, it can happen.
So I guess it took it a step further. We also had issues with blood in stool. And I mean, thank God they grew out of it at a year, which the doctor told us was very common.
Yes.
But even, I mean, I, with my first, cut out all dairy and soy from my diet, and I was surprised at how many things actually had soy in them. So
Yes, it's very true. It's very true.
Anything you spray Pam with has soy in it.
Right.
But it didn't work. And ultimately, he had to go on one of those prescription grade formulas that had nothing in it because even cutting out the foods wasn't.
Right. It's very hard to determine food sensitivities. It is. And the reason is because there's no reliable blood test for it. None. So they can't, even if you take a baby to GI, even if you do an EGD on an infant, which nobody wants to do, put them under anesthesia and stick a tube down their throat, food sensitivities you're not going to find unless you do an elimination diet. Same goes for adults. Something like, or even children, ADD is often linked with some sort of nutritional deficiency. It's just a matter of determining which one. And if one kid reacts to taking dyes away and suddenly they're a much calmer child, another reacts not to dyes but to gluten. So it's very individual, and of course with a baby it's 1,000 times harder because you have to deal with your diet, you're dealing with a baby, they can't tell you specifically what hurts, of course. In cases like that and you can't figure it out and it's taking too long, absolutely it's a good idea to switch to one of those formulas, Nutramigens, etc.
I think this could, especially if we're dealing with moms with serious issues, I think if it's just what people call colicky, fussiness, and there's no rashes involved with blood in the stools or failure to thrive, then I found as a low latch leader that, especially with the moms we're going to be dealing with who have big families, that a lot of times it's just a matter of making sure you hold your baby more and have that skin-to-skin contact. And I talked to a lot of mothers who are like, how many hours was your baby in the car?
Right.
The day-to-day, especially
Right.
when you have to be careful for so many other children and grocery shopping so much more with big families, that just making sure that your baby gets held that much more can reduce the fussiness.
Yeah.
As long, without any other symptoms.
You're right, and I totally agree with you. Even as a dietitian, believe me, I know it's not always about nutrition 100%. Look, sometimes it could be an underlying medical issue, God forbid. But it could be. Sometimes, they just want to be held, they just want to be rocked, they just want to nurse, whatever it may be, they need comfort, they need love. Obviously, why babies cry is a whole discussion way beyond my field of expertise. I cover the nutrition basis. It's worth looking into nutrition, but yes, it's absolutely not the end-all be-all, for sure.
I think it's important just to make one comment also that if we're dealing with a mom who does have a mood disorder, there is a possibility, a big chunk of how that impacts the baby is a lack of
That's
attachment.
very true.
And so a mother may be struggling with the nursing because she's having a hard time connecting with the baby, or she's struggling with, she can't hold the baby like Stacey describes because she's having a hard time physically and emotionally connecting to this newborn. So acknowledging that
Absolutely.
there are factors when we are dealing with a mood disorder that directly will impact the nutrition of the baby as well.
It's going to impact the nutrition. Emotional eating, and we can talk about that too, is going to be a much bigger factor in a mom like that. But absolutely, you have to, in every case, you have to look at it as a case-by-case basis in terms of what are the factors. If you have a mom who is, nursing, giving her baby all the attention, it's their first child, they're doing everything they're supposed to be doing, and the baby is miserable and maybe also has some other issues like gas or a rash or something like that, maybe that's a clue towards nutrition. It's certainly worth looking into, but absolutely, it's multifactorial. You have to look at everything, for sure. Any other questions on allergies? Colic? Yeah.
I just, at least in my experience, if the mother is coming to you with this concern, I would ask if there's any food sensitivities on either side, because I don't have any food sensitivities, but my husband's side has a ton.
That's very true.
So with both my kids, we experienced some stuff, and it was okay, I asked him what am I eating wrong that it's all for me.
Yeah, it's very true. Genetics do play a part, absolutely. It might even be worth to say, hey, does anybody in your family have Crohn's or ulcerative colitis or something more major that, God forbid, you don't want a newborn to experience, but unfortunately, in those cases, it might be worth a referral to GI or at least to their pediatrician, for sure. what I generally find with people is that there are little clues, things like the constant ear infections, eczema, congestion. They're very often related to dairy. Again, not 100% for sure, but very often related to dairy. Something like gas could be more of your high fiber foods. It can also be wheat. Wheat is a big contributor to GI. So little clues like that also can sort of gear you in the right direction. Okay. Let's talk about fat for a second. And we went into this a little bit, sort of describing with the ALA and this and that. I mean, even looking at a food label, what do you see? Monounsaturated, polyunsaturated, unsaturated. It's very confusing. There are a million different types of fat. Back when I was probably still in school, I think the whole trend was low fat, low fat, low fat, which has really been totally, repealed at this point and overcome. That nobody should be afraid of fat. And this you're going to find also in women going through some of the changes of, oh my God, I'm not going back to my pre-pregnancy shape. We'll get into that too, believe me, that they're going to avoid fat. So I just want to definitely push that fat is incredibly important. 30% of our total caloric intake should come from fat. Now we want it to be healthy fats, for sure. Anything that's a liquid is going to be better. A solid, anything that comes from an animal, saturated fat, not as healthy. But the key with nursing is variety. Because like I said, 60% of the brain is made from the DHA, EPA, but there's still that other 40%, not to mention the entire other nervous system, not to mention fat that is coating their organs, producing hormones, all these functions of fat in the body that you really need a good variety. This goes for everybody, by the way, so this is just sort of general nutrition advice. A good variety of different fat sources, very important. Nuts, avocados, olives, also very good sources of fat. It's one thing to just say to the mother, if you get any clues that she's dieting, that she's avoiding fat, that she's avoiding certain food groups, definitely make it very clear. And all of these are very important, especially when breastfeeding, for the baby and for their own health, but definitely for the baby too. You see a lot of people on fad diets. I'm avoiding all carbs. Nobody should go on a fad diet when they're breastfeeding. We'll talk about weight maintenance, but for sure, anything that cuts a significant food group out, not a good idea. Food groups are what give us a good base of nutrients in our diet. Nutrients is what that baby needs. Kind of make sense? Okay, so a good variety, again, olive oil, canola oils, all good. Smart Balance is my favorite one, or Earth Balance, for if you need a good solid. Those are good too. Okay. This is a question you sometimes hear. Do I need to drink milk to produce milk? Now, most people probably understand that that's not the case at all. But it is sort of common knowledge that you need to drink more milk when you're pregnant and when you're nursing. It's not necessarily the case. Obviously, your body's going to make milk no matter what. You need good hydration to make milk. You need good water content. You need some good fats in there, some carbohydrates. You need protein for sure, but you don't need milk specifically. I notice through my pediatric practice and through my own kids that pediatricians really, really still push dairy. Does anybody here not eat dairy? Anyone off dairy? A little bit.
Pediatrician who said no dairy.
That's interesting. That's very interesting. That's good. I like that, and that's a little bit more up on the research. So I definitely like that because we need dairy because you need calcium and vitamin D and protein. That's it. But there are so many other sources of those nutrients that you don't necessarily need milk. So I know when I take my kids to the pediatrician, that's the first thing they ask. Oh, do they drink milk? Do they have dairy? You don't need that. What you need is calcium. So if somebody asks you, do I need milk? No, but you absolutely need good sources of calcium in your diet, for sure. You'll see there's a very long list that I pulled up on just the different amounts of calcium, but the main thing up top is that a nursing mother needs 1,200 milligrams of calcium. Super important. Not just for the baby's sake, but for the mother's sake. Because what's going to happen if your body is going to make sure there's calcium in that milk. However, if you're not eating calcium, it's going to pull it right off your bones, and then all of a sudden you're going to be an 85-year-old with osteoporosis, which nobody wants. So definitely push calcium. If they're not eating dairy, no problem, totally fine with that. That's the one food group I would say is actually okay to pull out if they need to, as long as they're getting calcium And here, it does go through, there's a bunch of vegetables, fruits, beans, grains that have calcium in them. Not to mention the fact that everything's fortified nowadays. I'm sure you see that, coconut milk, almond milk, rice milk, everything's fortified.
Orange juice.
Yeah, orange juice.
Is there any way of telling if a baby or a child isn't getting enough calcium? Are there any
There's no
some people
signs
say,
and
there's
symptoms.
a white in your nail or...
Rickets is really the one thing you would see, which is like sort of that bow-leggedness, but it's so rare in this country, so rare, because we have good nutrition, thank God, in this country, that we don't really see it very often. More and more pediatricians are testing for vitamin D deficiency, which I think is great, personally, because again, vitamin D not only helps them build bones, but is good for immunity.
How do they test for that?
A blood test.
I have a question about
Yeah.
calcium. I heard that every baby leaches calcium out of your teeth specifically, which is why some women have a phenomenon of having really bad teeth after they have kids.
That's very interesting. I've not heard that.
I would have by a doctor.
Yeah.
Is there any way of replacing that? Like you're saying, you should need calcium so that you shouldn't be an old lady with osteoporosis.
It could affect your dentition
and also
too.
that as a person gets older, it's harder and harder to put the actual calcium where it belongs.
Absolutely. We tell women, and I tell this a lot, again in pediatrics, that you have up till you're 24 to absorb calcium into your bones. That's it. Then you're done. So then the whole point of getting enough calcium, especially because many mothers are over 24 when they have their babies and they're nursing and they're breastfeeding, is to make sure it's not coming off. It can pull off your teeth for sure, for your teeth, from your bones, etc. That you're getting enough, you're eating it, it's going into your blood, it's going into the into the milk, excuse me, and it's not needing to pull off your bones and your teeth.
So this what you're saying is that if you have enough calcium, a person won't lose from their bones.
Exactly.
But
If you're
not
getting
this
enough
is
dietary
going
wise.
into your bones.
Right. Right. Exactly. Exactly. Yep.
How many milligrams of calcium is in a Tums?
Extra strength is 750. I think regular strength is like 500. Just a quick note that your body will not absorb more than 500 milligrams at a time. So some of these supplements that are 1,000 milligrams at once, not really gonna...
In anything or just in calcium?
In anything.
So when they prescribe 1,000 or 10,000 of vitamin D, what's the...
Vitamin D is fine. You'll absorb it all at once. It's the calcium that needs to be split up.
Only calcium is not.
Yep.
So if a mom would take a Tums in the morning and a Tums in the evening, she's got her calcium taken care of.
Yep. Yep.
And also the chewable chocolate chews that have
Viactives.
vitamin D and calcium.
Why not?
They've got it all now. They've got it in gummy. They've got it in orange flavor. They have everything. Yes.
Isn't there some research now about like the Tums and like calcium supplements being bad for the heart because they can like clog it up?
Too much calcium can cause heart problems. Yes. So it's something that people in general taking supplements and taking any kind of Tums, vitamins, anything like that, really, or even just eating a lot of calcium in your diet, really don't have to worry about. It's more, like you'll see it in the hospital more often when somebody has kidney disease and they're retaining calcium and then they end up with heart attacks because that. It's more of a metabolic, really illness kind of issue. The general population really doesn't have to worry about that. Yeah. Okay. Any other questions on calcium? We're good? Okay. So we'll skip ahead through this long list. There we go. Okay, so iron is the only other food I really wanted to, or nutrient rather, that I really wanted to focus on. And again, because like I mentioned, come 6 months, of course for some women it's 2 months, and for some women it's 2 years, women start to menstruate again. You're losing your iron. You're losing your own iron source. Yeah?
I'm sorry, can I go back to calcium for 1 second?
Yeah, sure.
Is there any need to take something else at the same time, or like for it to be absorbed? Or is there any problems with that? Like I know some things don't absorb by themselves, like...
That's true. Calcium is better absorbed with D and magnesium, but you'll notice most calcium now comes with D and magnesium connected to it. But it's not 100%. It's not like iron, which we're about to talk about actually, which absolutely needs vitamin C with it at the same time.
Okay.
Yeah. The truth is with calcium, as long as there's D and magnesium in your system, it's going to be fine. Your body will store it.
Okay.
Okay. Iron, like I mentioned, come 6 months, not a bad idea to either supplement the baby or your own milk. Some doctors will recommend to supplement the baby. I say, why give them that iron? It can, honestly, it can cause constipation. It can stain their teeth if they have them yet. You know, you've seen those iron dyes. They're really strong. I think it's better to supplement the mother, or just eat a lot of iron. So I just figured I would go through here. I'm sorry I didn't take off the shellfish. I realized that's on there and not applicable. And the ham. Sorry. I apologize. But anyway, iron-rich foods, there's two kinds. There's what we call hemi-iron, which is coming from an animal. So any kind of meat you're eating, you're going to get that iron. It does not need anything else. Your body's just going to absorb it as is. Okay? Then you have your plant iron. Lentils, beans, spinach, fortified cereals, seeds, tofu, all really good foods. High in protein, high in iron, all good stuff. But they need vitamin C with them. You're not going to absorb it without C. So a little glass of orange juice, almost all fruits and vegetables have C, to be quite honest. So even if you wanted to throw a couple baby tomatoes in your mouth, whatever you have lying around, a little bit of grapefruit, fine. It'll help you absorb it. But that's important at a certain stage. Any questions on iron? Yeah.
Well, I'm reading the thing. Why do you have 3 ounces of beef or chicken has 3.5 milligrams, but then 3 ounces of cooked beef is just 2.5, and just 3 ounces of chicken is 0.7 milligrams? You see that?
They're just showing the different levels of what has more iron and what has less iron.
But, right, I hear that. But in the 3.5 milligrams, you have 3 ounces of beef or chicken.
Uh-huh.
So why is the 3 ounces?
Oh, I see. It's 3 ounces of chicken down there. It's really going to depend on the type of chicken. Dark meat is going to fall into the higher category with the beef.
Oh, I see.
That's the reason it's dark. A white meat is going to fall into the lower category. Yep, that's why it's dark. Okay.
So from all of these supplements and all of these, the vitamins,
Mm-hmm.
I'm imagining a very overwhelmed mom, maybe a new one, who's trying so hard to get it right, trying to do it right, and
Mm-hmm.
She says, I don't know what I'm supposed to be eating or how much I'm supposed to be eating. What would you say is the most, number 1, number 2, number 3 most important things that they should be focusing on?
Calcium, iron, protein, and hydration. We're going to throw hydration in there too.
It's a meal train. Meal train.
Yeah, and again,
Meal train, all food should include high iron, calcium.
Right. And look, the truth is I do recommend, I do put some of these numbers here. Like, yeah, you should have 10 milligrams of iron. Yeah, you should have 1,200 milligrams of calcium. I would never, ever recommend to a new mother that they count. Ever. And I don't even really recommend that in adult practice in general, is counting, unless of certain conditions, certain cases where it's absolutely necessary. It becomes obsessive, it's dangerous, and it's going to take a lot of time, and it's going to be more stressful. The last thing we want to do with a new mother is add more stress. So to just give them sources like, be eating some of these foods, be eating some of these foods with calcium and some of these with iron is a much better bet. They're going to be checking a woman's blood work anyway. I mean, that's what they do when you go to the doctor. So they'll be able to say, yeah, you're anemic, yeah, you need more iron, etc., if that's the case. Yeah, any other questions? Yeah.
Wouldn't ask, seeing if the prenatal vitamin, wouldn't that be a good source for them? And just an imbalanced diet?
Well, yes, with iron, yes. Certainly not with protein. Protein, you gotta, even if you're not eating meat, you gotta get it from beans, nuts, etc. Here's the thing with iron and calcium. We were talking about, certain things not absorbing with other things. Iron and calcium together, you cannot absorb either of them. They will bind together and you'll excrete them from your body. So a good prenatal vitamin, and most of them will have 100 to 150% of iron, because they know how crucial iron is. But they'll have about 10% of your calcium. Now, I had one doctor, I remember when I was pregnant, sort of blow it off and say, yeah, you don't need more calcium, you're getting that a little bit from your prenatal. It's not nearly enough. So the calcium, I would say, if somebody is taking a prenatal, the calcium is more important. Yeah.
So are you saying that if you're eating iron, let's say you're eating liver, which is extremely high in iron, and then you're drinking a glass of orange juice with it, so both are negated?
Exactly. Now, if you really want to get into the nitty-gritty, it's usually only if there's more than 10%. So if one of them only has 10% of calcium and one's higher in iron, it's fine. If both of them are higher than 10%, then it's no good. Yeah. Little things. Okay. All right, moving along. Are we good? You want to stop? Or
Just take a quick stretch.
quick break? Okay.
5 minute stretch. I need to get a sign in. You want to sign in your notebook or? I'll put it in mine. Okay. You want to just press pause on the recording? Or just hold it? Is it showing as recording?
Yes, now it is recording. Okay. So the next topic that I'm not going to read this whole thing. I'm going to sort of skim through this. This is really, a lot of people ask about weight loss. It's a very big topic after you give birth. This is actually an article that I copied and pasted. It's from a journal of nutrition. But most of these articles that you find in journals are very, research-based, very fact-based. I actually thought this was extremely sensitive to the feelings of the mother and what she's going through. So I actually just copied it for your, reading pleasure whenever you get a chance. I'm going to go through it a little bit, but for the most part, I thought it was just extremely sensitive to the fact that, you know how you feel after you give birth to a baby, and it's very hard, and just to deal with the bodily changes, and you want to go back to your old clothes. You don't want to be wearing maternity clothes when you're no longer pregnant, but you're not fitting into your old clothes anymore, and it's a very sensitive topic, and it's something that can honestly cause a lot of depression in a mother to deal with those. It takes a while for sure. So a couple facts that I will run through, again, you can sort of read this on your own, is that your body does change. So that is a fact. And there are things a woman is going to have to accept, that not all of your clothes are going to fit anymore. Your body does change, but thank God you have this beautiful baby here, and it's so worth it, and to push the positive as much as possible. But when you're pregnant, you're storing a lot of fat. And once you develop fat cells, they stay with you. And fat cells like to get bigger. Unfortunately, this is just the case of weight gain. Those fat cells stay with you for life after you're pregnant. So yes, you can control it with diet and exercise for sure. But a woman does have to acknowledge it's not going to be the same. Your hips are going to change. Certain things, your breasts, obviously, if you're breastfeeding, while you're breastfeeding, are going to change, and afterwards too. So that is just a fact, and definitely has to be presented in a very, very sensitive way, I think, to a mother. You guys are dealing with people before 6 weeks, after 6 weeks, a little bit of everything? Okay. I will generally tell you that you want to wait for the doctor's okay before you begin any diet or exercise, which is usually at the 6-week checkup. Would never want a mother to feel guilty, ever, about, they say, I just don't have time, so I'm eating a box of donuts. It is what it is. There's no reason before 6 weeks why a mother shouldn't. There's a lot of emotions. Emotional eating, in the long run, of course, as we all know, is not a good thing in the long run. If they need that for the first 6 weeks, go for it. There is no guilt, nothing involved. 6 weeks, great. After 6 weeks, not all mothers have healed. Just because the doctor says it's okay, just because technically, in America, you go back to work after 6 weeks, doesn't mean necessarily that you have to start a nutrition program right away. Things are a slow process. So, definitely within the first couple of months, it's definitely important to start paying attention to overall nutrition, especially if you're breastfeeding, or in general, just to lose the weight. But those first 6 weeks, I would skip nutrition. Have a box of donuts, have a chocolate bar. If that's what you need to help you deal with the situation, go for it. Once you do start, there's definitely going to be issues. Time, availability, your body is different. Exercising is hard, but at least now they have a lot of mom-baby classes. You guys have those around here? I know we have a lot near me. A lot of mom-baby gym classes, mom-baby yoga classes. No?
Unfortunately, there's not many.
There's really not so much around here. That's a shame. All right, send them to South Jersey with me. But ultimately, in Center City, they have Baby Boot Camp. I don't know if they have that out here. It's something to look into. It's a good resource, Baby Boot Camp, because it's a group of moms that get together and walk with their strollers, and then they do like calisthenics. I used to do this in Washington Square Park with my first baby, and honestly, it's nice because it's another support group. You're there with other mothers exercising with their babies. Otherwise, it is hard. Include your baby, just walking, start slowly. Most importantly, the thing for a mother to understand is that the weight loss is not going to happen overnight, especially if you're breastfeeding. Normally, when we talk weight loss, we're talking you have to take 500 calories out a day. But as we mentioned at the very beginning, we're adding 500 calories a day back in for breastfeeding. Generally, with breastfeeding, I push a general healthy diet. Lots of fruits and vegetables, whole grains, lean meats, good protein sources, etc. Just like I said at the beginning. Weight loss shouldn't be expected at more than like half a pound to a pound a week. That's it. You're going to lose that initial 10 pounds, and then a lot of times your body within the couple weeks will release fluid. So a lot of times you'll be down 20, 30 pounds, depending on how much you put on in the first place. But that excess that's staying with you, it's going to take a while. You ever hear the saying 9 months up, 9 months down? It's and sometimes honestly it's longer. There are women, and of course you've seen them, that lose it like that, and by the time they're at the bris, they're back into their normal clothes. So there are women like that. Most women, it takes a while. Sometimes it can take years, because like I said, there's emotional eating factors that go into it. There's nursing is a big factor that goes into it, and ultimately it's going to be a very slow process. Yes?
I was also talking from experience because I've had 4 C-sections. Most C-sections are...
It's much harder. Much harder.
Feel it.
Yes, 100%. It's much harder. Absolutely.
And you'll never get, people who have C-sections, you'll never get that flat.
Yes, where they've cut the abdominal muscles, that's cut. Exactly. It's very true. And again, that can be very, very frustrating and very emotional to a woman. What I would generally tell people is that it can happen one day, but it's not going to happen right away. And I think a mother is going to have to accept that it's not going to happen right away. But down the line, your child will sleep through the night. Down the line, you'll have a little more time. They'll be in school. Everything will be okay. And then you can get back in shape and focus on this stuff. It's important. Nutrition's very important, but focusing on weight and that weight loss, maybe, we need to sort of shy away from that a little bit, because we don't want to push it. This is more just if a woman asks you. This is the rate. I wouldn't expect more than half a pound per week, max. Yeah?
I think part of the challenge also is, let's say, especially in the younger years of an Orthodox woman, that I think there's a pressure to get thin quickly because there's a possibility of them having another baby fairly quickly thereafter. Even if they're spacing if their babies are spaced, 2 years apart, they're still not, that's not a very long time to get back to where you'd like to be.
Right.
I think that's part of the challenge of that feeling of pressure, of time pressure.
Yeah, it's very true.
At that time, it's 2 years.
Nursing, right? That's exactly what I'm saying. You're going to get pregnant again, and you're going to have another baby. So.
Yeah, it's very true. And, it's very hard for a woman in that position who's really upset about that in the moment, and that is their focus, to be able to look down the road and say, there will come a time where my kids are in school. There will come a time where I'm done having kids, and I can get back in shape. Even if I'm 45, I can absolutely get back into shape at that point. If they find it reassuring, that's a possible way to go. It's just tell them it can happen down the line. Enjoy your childbearing years. Enjoy it while you have those infants. But
you have to be really confident to feel that way.
Yes, you do. It's a very, very hard thing for a woman to go through that. So again, like I said, I'm not necessarily going to go through all of this. Loss of control, for sure. You're exhausted, for sure. The one thing I did want to highlight, though, is it's probably important to know if a woman has had a history of any kind of eating disorder. Because even without an actual diagnosis of anorexia or bulimia, even someone who just has a habit of restricting or taking laxatives or something like that, or over-exercising every day, those are red flags, 100% red flags to look for, especially if they're breastfeeding. Because the child's not going to get the nutrition that they need, because the woman has unfortunately become a little obsessed with their weight. Even for a mother who is not breastfeeding, it's definitely important. You need to have energy to take care of a baby. You need to have good energy. You have to have good nutrition to have good energy. So that's a key factor. If there's any kind of past medical history of any kind of eating disorder, it's a definite cue to get some sort of psychology involved, 100%. Anything else I wanted to cover in here? There's a couple suggestions of books in here. that contain good information on postpartum weight loss and exercise. What I'm going to do next, now that we're done with this handout, is I'm going to get into just a little bit more of general nutrition, which is important for any postpartum mother, and a little bit on general weight loss, which is important to both, but more so pertinent to a postpartum mother who's formula feeding, because then they don't have to worry about the nutrition and the extra calories, etc. I'm not going to take a ridiculous amount of time on this, so I'm just going to touch on some stuff. You have all these?
Yep.
You guys have all these. So a lot of these things that I'm going over, like I said, they're just good resources for you. Like somebody said before, if the mother has a question and, it's better to quote an expert than to go online and sort of go through all the different information. At least you can pull this out at some point and say, look, this is what the dietitian says, etc. Hopefully that will be effective. So just general nutrition for the postpartum mom who is not breastfeeding and who is breastfeeding, but especially who's not. Carbohydrates, very important. Again, you don't want to cut carbs. A lot of people think carbs are horrible. They're not. They're really important. You need 50% of your diet to come from carbs. Now you want them to come from whole grains, certainly better. Simple carbs, added sugars, things like that. Obviously, we want as little of that as possible. But still, carbs are important. Potatoes, sweet potatoes, peas, corn. These are all carbs. All good stuff. Okay? Avoid the low-carb diet. We just talked about that. MyPlate, we talked about that too. Most people have heard of MyPlate, but you can always show them. Protein, very important. Again, if you'll notice, it says needs are higher after surgery. Anyone who's had a C-section, you're going to need a little more protein. So that's important to know too. Okay? And fat is needed too. And again, this is just sort of running through all of your nutrients, sort of saying you need everything. Please don't cut anything in an attempt to lose weight. Fats in your diet, we sort of went through this already, just about the different kinds of fats. I'm going to skip ahead. Yeah.
I just thought, after surgery, also besides protein, iron. I needed a lot of iron.
Yes.
Because I know you said not to take an iron pill until later, until you get the period, but
yeah, it's especially important. Yeah, for sure. With blood loss. Any kind of blood loss, you need iron to make up for that. Absolutely. Know your calorie needs. I'm going to start here because this is look, people are going to ask about weight. This is a good way to calculate your calories. The other thing I wanted to show you very quickly, anybody go on MyFitnessPal? Yeah. I did pull that up as well. Lose weight with MyFitnessPal. This is a great thing to have. I love this one because it's free. Definitely write this website down if you're not familiar with it. It's a good one. It calculates your calorie needs for you. I'm not 100% sure it assesses for breastfeeding, but it's good in general because it's a good way to track. Journaling can lead to higher rates of weight loss and maintaining weight loss than anything else. This is a good way to go. It's an app also. And that way people will just know their calories and know what they have to stick with. It's a good education tool. This one, I'm going to flip over here for 1 second, choosemyplate.gov. This is a great website. Love this website. And the reason, of course, that I really like it is because you can go to... there is no internet connection. Never mind. Okay, the point is that ultimately... that one, the myplate.gov, choosemyplate.gov, if you want to write down that website too. That's a really good one if moms want a guideline because it gives you the option when you go in to really individualize it. It asks you your age, your weight, your height. It asks you if you're partially breastfeeding, fully breastfeeding, postpartum. It goes through everything. I love that. And I went through it, actually, not that I'm postpartum, but I put in postpartum for myself just to see what came up. And I think you have that also, that it came up with the serving sizes that would have been appropriate. And again, the handout that's in there is the one that, I put in my own height, weight, and age. But anybody can put that in and it'll calculate it appropriately for weight loss, weight maintenance, if you're breastfeeding, if you're not breastfeeding but happen to be postpartum. And it tells you should have this many vegetables a day, this much fruit in a day. Just if somebody needs more of a guideline and wants something more to help them lose the weight, that's a really good website and a really good resource. Yep.
Does that in color on the right?
Yeah, but yeah, you can. I'm not going to try to log into the internet right now, but just if you were to go to that website, you would click on the my personal calorie tracker and then put in all your information and it'll give you everything. So that's a really good resource for somebody also. Sneak back up here for a minute. Where was I? Oh, here we go. So this is again just a general calculation for calories if somebody wants it. As much as I say that I don't love counting calories, and I don't, some women feel more empowered if they have the information. It's true. So to tell a woman, oh, let's calculate your calories, let's do your height and your weight and figure out your calories, and you need this many calories per day, sometimes they feel better just having that information, not it being this, sort of world of not knowing what you're eating and how many calories go in. Some people do feel empowered by that and by something like the MyFitnessPal. So that's a good option too.
I think I want to just put in a little
Yes.
disclaimer or comment here. I think to remember that our role would be if somebody asked us for this information.
Yes, 100%.
Offering this information.
100%.
Hey, do you have any idea how many calories I'm supposed to be eating? Or am I
Right.
supposed to do about all that iron? Am I supposed to be eating more iron? It's more about being knowledgeable about that you are
Yes.
a resource in that, but not pushing this information. We're even asking the mom, by the way, how many calories are you eating? Like, we're not asking that
No.
information, but
Yeah.
being knowledgeable about it.
I think during the postpartum time, the less focus on calorie counting and the less focus on weight, the better. But of course, if somebody asks, yeah, we have information that you can give them 100%. Yeah. Certain habits that make us gain weight, skipping meals is one of them. Again, sometimes you'll find people doing that. I'm just going to run through and see because I know we don't have a ton of time left. Not getting enough fluids, very important. You need water to metabolize fat. That's a big one. Empty calories. Everybody knows that. Sugar, soda. Let's put it this way. Everybody knows it. Applying it to our actual lives is much different. So that's something to note too. Eating out, much less pertinent in the religious community than it is anywhere else, for sure. Let me see. 1 pound out of here. I don't want to, spend too much time just because I know we don't have the time. Scourge hemorrhoids, about alcohol, eating healthier. Okay.
This is your homework. You got to read through this.
Yeah, and again, you don't even have to necessarily read them as long as if you're with a mother, you can pull it out and say, oh, yeah, here's this information right here. Let me see what else I have. The other resources that I provided for you. This one I thought was a good one. This is actually a presentation I gave to a non-Jewish group at New Year's, which was how to keep your New Year's resolutions for weight loss. I included it in here because I thought it was just a good resource for people in an attempt to set goals and lose weight without getting frustrated. Most people in this world, 98% of people have a hard time sticking with diet goals and losing weight. 98%. So especially when somebody is super highly charged because they have a baby and they're super highly emotional, it's a really good idea to be able to give them advice on starting any kind of diet plan very slowly and being realistic. 100%. They really have to know how to set maybe one goal per month, something small like I'm not going to drink juice this month. That's it. Something very, very small, something very, very manageable. Because I don't want these women to suddenly feel like a failure when it doesn't work. Do you know what I mean? Or when they can't stick with it because they've been up all night and the last thing they want to do is cook in the kitchen. And they end up grabbing something that's unhealthy. I wouldn't want to guilt trip anybody. So if you're sitting with somebody and they say, I really, really want to lose weight, how can you help me lose weight? The most important thing, I think, is to really just say, okay, let's be super realistic about this. You're tired, you're going through a lot, you've just become somebody's 24/7 slave all the time, and you really need to be very, very realistic and just help them understand that so that they don't get frustrated in the long run. Kind of makes sense? Any questions on that? So again, plan ahead, plan for support. Any kind of support system is very, very helpful. Even if they want to journal it, even if they want to see a dietitian, whatever sort of helps somebody to be realistic but stick with a healthy eating goal. Okay, so that's another resource. One of the other resources I included, which we sort of have gone over in and out through the presentation, was the vitamins and minerals. Why is this not coming up? Okay, so this again is another presentation that I sort of made separately, but very much applies to a postpartum mom. Again, we did specify earlier certain things that need to be pushed a little, not pushed, I shouldn't say that, focused on a little bit more with a breastfeeding mother. But even a formula feeding mother is going to have questions about supplements. This is just a good resource if they have questions to add, to let them know about certain things. Okay? Does anybody have a question? I don't want to really go through it just because of the lack of time. Is that okay? But does anybody have any questions on supplements or weight loss or anything like that? Yeah.
I have a question that's not directly related to this. If you don't mind.
Yeah, sure.
Last year, Reader's Digest had a whole article about why Americans should not take vitamins.
Yeah.
What does the medical world have to gain by putting out an article like that?
What does the medical world have to gain? I don't think the medical world has much to gain from it. I think that the general population has something to gain from it and that you're not wasting your money on supplements. What this presentation does go through is tells you how to take supplements correctly, like we talked about iron with vitamin C, something like that. It also tells you in certain situations, like somebody who's a vegetarian, somebody who's breastfeeding, somebody who is gluten-free. Certain situations are going to call for different supplements. Overall, somebody who eats a normal, healthy diet, no, probably doesn't need supplements. Yeah.
So it's telling you don't take calcium with all these things. So when do you take calcium?
Calcium is a very tricky one.
Like at 2 o'clock in the afternoon?
First thing in the morning, unless you're a coffee first thing in the morning kind of person. 2 o'clock in the afternoon. Just look at when you eat things. Okay, yeah, I tend to have leafy vegetables with dinner. Yeah, I tend to have tea or coffee in the morning. Take it separately.
Other medications that you shouldn't take at what? Like
calcium?
Yeah, for example, I'm hypothyroid. So I take a Synthroid every morning. Is that something that shouldn't?
Hypothyroid shouldn't affect it. The only things that can affect calcium are antacids. Something like a strong antacid, like a Prilosec, one of those. Yeah.
Wait, so is it just a calcium pill, or if I'm putting milk in my coffee and I'm thinking I'm getting calcium from that, I'm not?
Yeah.
I'm not.
You're not.
It's a splash of milk anyway, even if you just...
No, I use latte.
Calcium's tricky. Calcium's very tricky. But again, super important for a breastfeeding mother. I mean, we just talked about calcium, how important that is. To let them know, okay, you really need that calcium, but if you're also drinking coffee, eating spinach.
Chocolate, you're not getting calcium?
Yeah, I do question those Viactives. I do have to say, yeah.
What about probiotic supplements?
That's in here too. Yeah, they're good.
I've heard that they're worthless if they're not like the really, really expensive kind that you have to refrigerate.
No, I do have a list of the ones that are better and the ones that are not. Now, I think general population, yeah, probiotics are good. In terms of a postpartum mother, yeah, they're part of the general population. They're going to be good. Does it add any special benefit to them? Probably not.
Can you address, I think it's important to talk about why supplements are really like a concern or versus something that are not being, remember, supplements are not, they're not regulated.
Yep.
So you can order one supplement from this company and what you think is the same supplement from another company, and one could have 100 milligrams of this in it and the other one can have, there's no uniform way of...
There's not.
Can you talk a little bit about that?
Yeah, sure. And actually, I think there might be a slide on that, come to think of it.
Is there like a brand, I guess, for that you would recommend? Like if someone says like, oh, I want to take more, whatever.
Of X, Y, and Z, right, exactly.
Is there like a
The prenatal is your number one bet, because a lot of those not the over-the-counter ones, the prescription prenatals are your best bet, because they're going to be more regulated. They're prescription, they're specifically for pregnant and nursing women. Nobody wants to mess with those. And nobody wants to have, God forbid, a lawsuit because a pregnant woman became toxic with vitamin B6 or whatever it may be. In terms of brands, what I usually recommend, and that's in here too, no more than 100% of anything.
No, I mean like...
Yeah.
Like...
Bluebonnet.
Right. Like...
Yeah, but
They're all under the same regulatory. I like Bluebonnet, but it's pretty much all under the same regulatory process. There's really no recommendation. What I try to do to teach people, and especially if people ask you, is definitely read through these slides, knowing which vitamins can be toxic in large doses, which I just pulled that one up, knowing for sure what was I just going to say? Yeah, which ones can be toxic for sure, knowing if they're worth taking these multi-doses of, sometimes you'll see 1,000% of something, they're not worth it. It's not worth the money.
So many of them, I'm just reminding you, they need to be kosher.
Yeah,
Many of these
they do.
vitamins absolutely have trace items in them, and they're not, and especially something that does not have a clear medical need.
Especially, by the way, the DHA and the EPA, which we talked about, crucial postpartum for breastfeeding women.
Prescription prenatal vitamins aren't kosher.
The what?
Yeah, they have
prenatal vitamins aren't.
they have kosher prescriptions.
They do.
I know.
If I can say something,
Yeah.
Zoller has a, the person who created all the formulas for Zoller, Mr. Zoller, I don't know what his name is, he actually takes questions to anybody who wants over the phone.
That's
You
great.
don't even have to buy his product. So
Yeah.
you call up and ask him, and he's like a certified dietitian, nutritionist, whatever it
Mm-hmm.
is. So if anybody has specific questions about different vitamins, they can always call him.
That's good to know too.
He also does email.
That's great. Yeah, it's very good to know, for sure. When I find this may come up with you guys with postpartum, is people are going to say, hey, I went to GNC and found X, Y, and Z supplement that's claiming to help me lose weight. So that's something you are going to find. And again, we'll jump up back here for a second. Children, vegetarians. Okay, we'll go up to, are they regulated? That basically they can't put in the wrong ingredient. If it says vitamin B6, it's got to be B6 in there. However, they can put whatever claims they want on the label. So that's important to know too. Someone says, oh, I bought X, Y, and Z supplement that says it's going to improve my milk supply. No. These claims are, I'm not saying the claims are true or not true, but they're definitely not regulated and definitely not proven. So those are some of the things you might find as people pulling things off the internet. Human milk fortifier, and actually, how much time do I have? Not much. I'll get into that too, but that's another one. Human milk fortifier, if a child is failure to thrive, if a newborn is not gaining weight. Human milk fortifier is out there that you basically supplement your own milk and bump up the calories with this little, couple drops in the baby's mouth. A lot of them come from different countries. They're not regulated at all. So definitely with any of these supplements, especially if they're giving it to the newborn, it's really better to, I would say stay away from them unless these claims are 100% true, which most of them we don't know. There's not enough research to know. Okay, given the time there, okay, here's what I'm going to do. I'm just going to show you the last one, which you don't have, but hopefully you'll get for them next time. This is just one on smart snacking, which is good. You also have in your packets the 100 healthy snacks. Those are just good because I just remember even with my first, I would start cooking something and then he would wake up crying and then it would be sitting on the stove for an hour, half cooked, and it's very, very hard to prepare food. So that list is good to give to the mothers just in terms of here's 100 quick healthy snacks you can have available. This presentation, I won't go through it now, but it's pretty much the same thing. Just healthy snacks that are quick that you can have available that are good, dense nutritional sources without going for the usual chips, donuts, chocolate, etc. So we'll get that next time. Again, just a good resource for you to read through. The last thing I want to do, because this is important, I don't want to leave this one out, is newborn nutrition. So I'm just going to pass this out. This is just some general stuff. I'm not going to get into, I'm only doing newborn. I'm not getting into when to introduce solids. I didn't go that far up into it. That's something really, they will give you advice at the pediatrician's office on when to introduce solids, things of that nature. This is more issues of the initial newborn stage, which I figured was appropriate for the postpartum mom. So breast milk safety, anybody who's pumping, anybody who's back to work, this is just some basic safety that you pump in small quantities, store it individually, time limits for freezing and refrigeration, just general information, that's important. Formula. I'll get into formula for 1 second. There's cow's milk, soy-based, and protein hydrolysates, which somebody told me one of those specialty formulas, Alimentum, Nutramigen, things like that.
That you can't buy in the store that only
The prescription, yes. And they're super expensive. They're very expensive. Yes, they're very expensive.
But no, the Alimentum and the Nutramigen, I think, are made from pig's milk. Those are pigs' something.
derivatives.
Yeah.
Really?
The alimentum and Nutramigen, they're trace.
Yeah, so that's something, depending on your child's failure to thrive.
I had that issue on pizza. Like, what do I do with the tray? Not kosher for pizza.
Right.
Formula.
And that's something, look, you'd have to ask a RUV and get your doctor's opinion in there. Because if your kid's not gaining weight, failure to thrive, that's, going to be an issue. So, yeah, for sure. Yeah.
Breast milk safety. I learned something completely different.
What did you learn?
I mean, I have been told that you could freeze breast milk for like 6 months.
Right.
So here's what I've read is depending on the temperature of your freezer is what I read. If you need like that deep freezer that's like 0 degrees or below.
It's like on a top shelf in the back.
That will make a difference. Yeah. Versus a door. Yeah, for sure.
Also, I've heard it can be 6 days.
Right.
I heard 6 days in the 6 hours out, 6 days in the fridge, 6 months in the freezer. Something like that.
I have a feeling there's different recommends one of those cases where there's different recommendations out there.
What does this mean, pump in 2 to 4 hours quantities?
That you have to pump in small quantities just in case one thing gets contaminated, etc.
You mean for storage?
Mm-hmm.
Because I thought you're supposed
Like
to
if
pump,
you're sitting in a
until
pumping
like you're
session,
empty.
yeah, if you're sitting in a pumping session and you get 5 or 6, or
Yeah.
what should you do?
This is, if you're going to do a lactation consultant at some point, this is probably good to have them clarify. This is what American Dietetic Association is putting out. So, but again, that's not what lactation is putting out. There's probably a difference. I would ask lactation for sure to get clarification on that.
You would think, why are you pumping?
Right, exactly. Yeah, I hear you.
Well,
Yeah.
You know, you can't take your baby.
I'm kidding.
Yes. The one thing I want to clarify with formula is because people will say, oh, I'm going to try lactose free and see if that's better. I'm going to try soy based and see if that's better. Here's what I want to clarify, because if you have a baby that's irritable, that's fussy, that's vomiting, that's having reflux issues, we talked about food sensitivities earlier. But it's important to know that when you have a cow's milk based formula and a baby is not tolerating that, it could be one of 2 issues. There's the lactose, which is the milk sugar, but then there's the protein, the milk protein. So if you do a lactose free, what do they call it? Like Gentle Ease. There's all these really nice names out there. Similac free, all these really nice sounding ones. They're lactose free. That may not solve their problem. So definitely clarify to a mother that if it seems to you that your child is having an adverse reaction to a cow's milk based formula, you have to try both. A lactose free is not going to solve everything if the milk protein is bothering them. And I would say that the milk protein is one of the more common things that will bother a baby, a formula fed baby.
But I've been seeing a lot of talk about goat's milk formulas. Is that?
I don't know enough about them. Right. Yes, I will tell you that yes, in general, in the general population, goat's milk and sheep's milk are often better tolerated in people who don't tolerate cow's milk. However, any kind of formula given to an infant should be 100% fortified, and I don't know if those formulas are. So giving them just cow's milk or goat milk or sheep's milk, anything like that, is a big no-no.
I feel like I saw
based.
Recently, like there was a formula based with goat milk versus cow's milk.
If it is, it's new. I haven't seen it. But again, as long as it's an actual formula that's fully fortified and everything, you heard about that case in Israel. It was like maybe 10 years ago where it was like a German company and they took out thiamine, vitamin B1. They took it out and I think some babies died, unfortunately, because this company just didn't put thiamine in there. So any formula has to be totally fortified for an infant, especially a fully formula-fed baby.
What were the symptoms? I'm just curious with the babies that did not have thiamine.
Thiamine is neurological. Wernicke-Korsakoff is very common in alcoholics. You see them shaking like this because it's neurological, that they're not getting that and their nerves aren't functioning correctly. So that's thiamine deficiency. Yeah. So just make sure, like I said, make sure the mothers know that if their kid's having an issue with formula, lactose-free, Gentle Ease, all these things aren't necessarily going to solve it. Unfortunately, people who are intolerant to milk are often also intolerant to soy. Not all the time. Like I said, everything's individual. But a soy-based formula may not solve all your problems either. So it's just, so that mothers know that if soy-based isn't working, if lactose-free isn't working, you may have an issue with milk protein lactose, and soy protein. So then you do have to go to those more expensive formulas, unfortunately. Yeah.
Probably more of a question for Deborah, but like if a woman is trying to nurse and it's not going well, is it our place to suggest that, you know, I don't know, like nursing, it doesn't work for everybody. Like it's not, like you're a nutritionist and you know, even you said like.
I'm not a lactation consultant. Well, no. I mean, I don't deal specifically with.
If our goal is to support the moms and a mother is struggling with something like nursing, and the lactation consultant isn't available or isn't helping her, and she's falling apart, our goal is on the mom. Our focus is on the mother. I think it's for us to be supportive of her and helping her find alternatives as well. And that.
Sorry. Yeah, I think women also need the permission.
That's correct.
To stop sometimes.
So that's right. Exactly. So I feel like if we remain focused on the mother's health, and mother's mental health is making sure that the mother feels supported in her decisions, assuming they're normal, healthy decisions, in terms of the care of the baby. And so, yes, offering that possibility that, I know it's so hard if you have to make that decision to supplement or to half bottle. I know for myself, like I'll say to mom, I had to do that. My baby was starving after 6 ounces of formula. You know, I nursed, and then 6 ounces of formula later, he was still eating. So kind of normalizing that experience, I think, is something that's very valuable. That's where our role is as the supportive voice to say, it's okay. Like, it's really hard, and it's not you. You're not a failure. But I do think that there are times we need to encourage mothers to seek alternatives if the consultation is not available. If they're so gung-ho on nursing and the baby's not thriving or they're not thriving, you've got to help them find the balance.
Yeah. I had a baby with failure to thrive, and my doctor's like, you need to wake up your baby if she happens to be sleeping every 2 hours around the clock. And she was barely sleeping as it is. And I'm like, there's no way in this world. That is really hard to use a baby.
Yeah, that'll do. I had a physician who said to me, I need to take medication, and I was like, no, I'm going to nurse. And I remember the pediatrician said to me, healthy mother equals healthy baby. And it's not about the nursing. I said, you need to be healthy.
Very true.
We need to have, and that's really our focus, healthy moms.
The other thing I would also tell mothers if they have a failure to thrive child, failure to thrive, it sounds horrible because it has the word failure in it. But it's not. This is not like, a God forbid instant death situation. I mean, it's when you get a diagnosis of failure to thrive, yes, you have to try to, add more fat to their, sometimes the mother has to supplement their diet. Sometimes you see a dietitian to get a good calorie base. There's things you can do, but help alleviate the mother's panic. Failure to thrive baby is based on the growth chart. And a growth chart is based on the general population. Like we said, there are kids who are going to be up here and kids who are going to be down here. It's very hard for a parent to realize their kid is not perfectly on the 50% line and they're not perfectly 100% normal, especially if they're below 5 or above 95. Parents tend to panic, and especially a lot of doctors will say something. Your kid's eating too much, your kid's overweight, your kid is underweight, kid's failure to thrive. It's not. There's so many factors involved, and it's not an end-all be-all. Yes?
So I comment on that also. My boys were formula fed completely, and they were on like the 90 plus percentile, and they always told me you're overfeeding, and I was like, I don't know what else to do. They're hungry. My daughter's also pretty high up there, and they're like, you're doing great, good job, keep nursing her. And I'm like, that's a huge double standard.
It is.
It's really insulting.
Yeah.
Because it's like breastfeeding, no matter what you're doing, how big your baby is, great job. You're formula feeding, you're doing a horrible job.
Yeah, it's sending you like that little hidden message in there for sure.
What time right now? Because breastfeeding is super in your face. Everywhere you go.
It is in the hospital when you give birth. It's all over the walls, right?
And social media, every sign up.
You should be doing it in the supermarket.
And it's if you don't do it, it's like, wow, you've really failed at this motherhood thing.
No. Here's what I would say about both breastfeeding and formula feeding. And I wrote this here too. I did write a basic rule of thumb, but again, when you write a basic rule of thumb, every child's going through things at different rates. I also wrote down the general average weight gains, but again, this is not information I would throw at the mother's faces because this is something only if they ask. If your kid gains, like 3 times more than they're supposed to in a month, they probably had a growth spurt. You're not doing anything wrong. You're not overfeeding them. Kids are different. It's hard. The other thing is ultimately kids, they'll give you a general list of when a child will go through growth spurts. I think they say 6 weeks is one. I think 2 to 4 months. I don't even remember exactly. But that's very individual. If your kid's starving, feed them. So things to look at that I wrote down, your milk supply. That's a big thing to look at. A mother knows, are you getting bigger? Are you getting, that hardness, or is it dwindling a little bit? If your milk supply is down, maybe your baby's not getting enough. Maybe you're not eating enough. If your weight is going down, if the mother's weight is dropping drastically, more than that ½ pound to 1 pound that we mentioned, that's a sign. You're not eating enough and you're not producing enough milk for your baby. And obviously the baby's weight. If the baby's weight is dropping, maybe they're not getting enough. Maybe they're just small. I mean, there's other factors involved, but there's something to look at. I'm not pushing meeting with a dietitian because I am one. I'm just saying it's not a bad idea, because if a mother's really concerned, they can get a calorie count. Do you know what I mean? They can actually write down how much their baby's eating. They can calculate an actual calorie count, etc. If a mother's super concerned, you can refer them out. But for the most part, if your baby's not falling asleep and using it for comfort, some people, by the way, that's okay. I'm not saying that it's bad to use, the breast or a bottle for comfort, but it could be a sign of overfeeding. Could be, possibly. Let's see if there's anything else that I wrote. Mothers using feedings for comfort.
Well, I mean, even just calling the PD. Oh, sorry, you had a question.
Yeah.
Sorry, I was like, all I was just gonna say was a quick thing was just that. Also, like, most pediatricians are like willing, like, if you wanted to do to weigh them, like nurse and then weigh, like that's just like a way to deal with it. But sorry,
No, I was gonna say, you mentioned, it would have been a total tangent, so it's fine. But you mentioned like the medication aspect. Like NIH actually has a database on medications that and most are actually safe for breastfeeding, and people get given the advice like don't breastfeed because the doctors want to err on the side of caution, and really
there are guidelines. That's very true.
Don't taking like a painkiller after C-section.
What's the website, Robin? NIH.
It's part of NIH.
Well, there's actually there's okay. You just had the list right here. You gave me a whole list. But there's a I think it's called Mom Risk is the name of the site. But any prescriber should know what the who to call to talk about postpartum medication. And many of these medications are just untested. And that's why it's kind of like do it at your own risk. But most of these medications, even if they cross into the milk, are not as not very high risk.
Right.
But a mother is going to have to assess that risk issue.
It's a risk benefit for sure.
Pardon? Infant risk. That's another one. There's mom risk, there's infant risk, there's a whole bunch of them. But
very
I
true.
want to put that aside. I think it's a very important point.
Dr. Hale is in Hershey. He's a big expert, and he'll take calls from like your pediatrician. I don't know about like from parents, but definitely from their pediatrician.
Right. Most of these hotlines will actually have physicians and nurse practitioners.
A good pediatrician should be able to give you a good resource, for sure.
Exactly.
Yeah.
Lisa had a question.
Just to remark on what you were saying about the failure to thrive label. I have to say, when my daughter was failure to thrive at 3 weeks, thank God I took that failure and thrive really seriously. She had dry diapers and was losing weight at 6 weeks old. And she was really
dehydrated, probably.
She could not get that formula in fast enough.
Right. I mean, it's definitely something to look at, but if it's a case like that where a child is at risk in terms of dehydration, for sure, that's a much more pressing issue. If a kid is just small, sometimes they're just small. Sometimes if they're eating, you have less to worry about.
So I think what's important, again, focus on the moms, is that if you were my mom that I was going to visit, and you were struggling with that, being forced to supplement, even though you saw the kid was thriving and you're so happy your kid's thriving, there still could be that feeling of guilt or shame or embarrassment. I don't want to tell anybody. I remember that growing up, in the younger years of you didn't tell anybody that we supplemented, because it was there was this shame or concern that I would be judged.
Or you had to wear that contraption when you sucked on
What
am I talking about?
No.
There was a
thing that you put on
and
to attach to your breast, and you were feeding formula, but it was to like stimulate. No, I wasn't that.
And I was like, what?
I've never seen that. That's
They do
crazy.
that with adoptive mothers, so this is if the breast is feeding, whatever.
They do it
Gotcha.
with moms who don't make enough milk.
Yeah, yeah,
I think for some people it is like a positive
Yes,
thing. you know?
because
Like, I've
that's
seen
for people who
with,
had
like-
medical breast reductions
Right.
who want to be able to breastfeed but can't. Those are, you know,
It helps them deal with whatever.
Right,
that they-
attachment.
Yeah.
But again, focus on the moms, focus on the mom's
Right.
health. So the mother's feeling guilt or shame or like sadness about failure, then that's our job. Support that mom and helping her. I can imagine that you might feel that way, but you know, we love you anyways, and you're doing a great job, and you're doing whatever your job is. Your baby's gaining weight, you're doing exactly what you need to do, and this is what it means to be a mom, not the nursing, but the caring for the baby.
And the fact that parenting in general it's trial and error. Sometimes it is. Sometimes, you know, you try one formula, it doesn't work, and you think you failed. Great, I tried something, I thought it was going to be better. It didn't work. I'll try something else until you keep trying until you get it. That's it.
I want to just be mindful of the time.
Yeah. Any other questions before we're done? Anyone?
I don't know about you, my brain's about to explode. But,
Do you have a question or a comment?
No.
Sure. Thank you.